Welcome, everyone. My name is Julie Pham. I am the CEO and founder of CuriosityBased. I'm here today with Dr. David Chang, and this is the very first episode of our brand new series called Respect in Practice, Decoding Job Cultures. This is where we talk about what does respect, communication, and relationship building look like in uncommon job professions. Part of this is just because I want to talk to my friends and people who are in jobs that I'm just, what is that? What does it mean to be a sleep doctor? And so that is what we're going to get to do today. So I just want to share a little bit about Dr. David Chang, a dear friend of mine. I think we've known each other for maybe 10 years now, right? Yep. And Dr. Chang is an award-winning sleep doctor, consistently ranked as a top doctor in Seattle Met, Seattle Magazine, and also has won a teaching award too for his sharing of his knowledge. And know he's a very well-respected sleep doctor. And so what we're going to do is we've got some, and Dr. Chang will also share a little bit about his background. We're going to just talk about how he got into this, and then we will dive into what does respect and communication and relationship building look like in the medical profession, particularly in from Dr. Chang's experience. So, Dr. Chang.
Thank you, Julie and Dr. Pham, for having me. I'm excited to be here with you guys this morning. I've been a physician for about 25 years now. I started my journey in internal medicine and then transitioned to sleep medicine about 16 years ago. And I really love practicing sleep medicine. Helping people sleep better is something I find quite joyful. And I personally love to sleep as well. So that's something I enjoy doing. And I'm excited to be here today.
Gosh, I think everyone loves to sleep. Sometimes we can't always get it, though. And I guess that's what you help people get, right?
So I try at least to educate the importance of how sleep can benefit your overall health. Yes.
Mm. So I'd love to hear, how did you discover your passion for medicine, and particularly how'd you decide on sleep? Of all the things you said, you started with internal. How'd you end up with sleep?
Yeah, that's a great question. I was a medical director of the clinic for residency program in Philadelphia, and helping patients and educating residents and medical students. And the sleep conference came to Philadelphia, and it was only 6 blocks from the hospital. So I actually popped over there to the conference many years ago, and really fell in love with the field, and went back and did my fellowship at Dartmouth to further my education. So it kind of fell into my lap in many ways. And since practicing sleep medicine, I realized how important it is to overall well-being and helping people maintain their health. So it kind of is a perfect segue from my internal medicine background into sleep medicine.
Has sleep become a bigger issue, or lack of sleep become a bigger issue over the years, or how has this changed?
Yeah, that's a great, probably sleep apnea. Due to obesity for a lot of people, but also based on bone structure in someone who's thin. And I would say the other biggest issue is insomnia, people just not being able to fall asleep.
So does that affect a lot of people?
Well, they say about 40 million people have sleep apnea that are undiagnosed in the country. And then insomnia, you can imagine, it could be short-term or long-term. Acute stress can lead to insomnia, or just chronic issues. Anxiety and depression can lead to insomnia as well. So a lot of patients may have insomnia, but really the underlying cause is an underlying mood disorder that they're just not aware of.
So, audience, get ready to put in your questions into the chat. And I want to ask one more question before we turn it over to communication and relationships. What do you love about your job? What do you love about sleep?
So a lot of patients will come into me highly skeptical that they have a problem, especially if it's a snoring or sleep apnea issue. They're usually asked to come in because of their partner or a friend, and they're just not aware that they have a problem. And then once their sleep, if they do have a problem and it's diagnosed and treated adequately, they kind of retrospectively look back in their life and says, gosh, I wish I got this taken care of years ago. So that's been very gratifying, seeing that people have benefit in terms of their daytime performance and function, as well as their overall health when their sleep is restored to what it should be.
Yes, I have friends who once they discovered that they had sleep apnea, it's just, "Wait a minute, I've been waking up how many times in the middle of the night?" And not even knowing that, and just the quality of their mood because they
Yeah,
discovered that.
it's kind of amazing. And what I tell my patients is kind of amazing that a third of your life is unknown to you and I, and yet we do it every night since the day we
Wow,
were
that's
born.
true.
It's kind of quite
Mhm.
amazing. A whole third of our lives are just unknown to us. And yet that's the part of the world I look at with my patients, which is really exciting.
Mm, mm. So, yes, a third of our life, and yet that third of our life impacts all the other our waking hours.
Yes. Yes, well
Mhm.
said.
So, well, on respect and practice, one of the things that we really want to explore is how respect can look different in different professions. And in and so, we have had conversations about the challenges around respect in the medical profession. We hear lots and lots of stories about how many people are leaving the medical profession, actually at all different levels. And so, I want to know what's happening there. What is causing, people to leave? Is it just burnout, or is it interactions with their colleagues? Is it interactions with their patients? What's what is causing this big shift away from the medical practitioner? I gotta say, when growing up, my mom was like, my parents were just be a doctor or be a lawyer, right? And so it was just always considered really honorable, and it surprises me that so many people are leaving now.
Yeah, that's a really great point, Julie. The challenge I think in healthcare is that it's with the pandemic and everything. A lot of people were burnt out from the pandemic, and I think it's a multifaceted reason why people are leaving medicine. I can't necessarily speak to the other parts of medicine, but for physicians, I think it has to do with seeing a burden of patients. Also, administration and the requests by administration of the physicians can be quite burdensome. And also, maybe even documentation with electronic medical record. There's a lot of clicks that physicians have to go through in order to get the work done, which takes away from patient care. And I think a lot of physicians go into medicine because they want to be in front of the
Mm,
patient. But unfortunately, as healthcare has gone along, people are asked to do more that has nothing to do with patient care necessarily. Not that it's not important to document what you're doing with a patient, but in terms of just the amount of burden of responsibility has increased, I think, over the last few years.
mm. So there are these expectations of around how much information should be shared. And, right, that's kind of what I mean, and technology makes that possible. It makes it possible, and yet then it sets up this higher expectation. Oh, we can, and so we should communicate even more with one another. And so how, um, so with that expectation, I'm hearing you say that it can be, it's taking away also from that kind of the human contact, that human interaction too, right?
Yeah, that's well put. I mean, I think when I interact with a patient, it's let's say a 15 to 30-minute visit, but on the back end, I have to probably spend the similar amount of time to document all that I did with the patient. And I think what ends up happening with the number of patients that need care, a physician may spend 2 to 3 hours after their clinic documenting what needs to be documented in the record, which is important, don't get me wrong, but also just takes time away from their family and their personal life. That's just one example why someone may leave medicine. Another is just the amount of expectations placed upon the physician and the healthcare team by patients. I think there's a certain expectation with the world we live in. Things are done
Mm,
immediately. And so things happen slowly in medicine for a reason because there has to be thought placed into something, and decisions don't happen quickly in real clinical medicine versus what you may see on TV or in your other parts of your life. I use the Amazon effect quite often. You order something in the morning, you can get something in the afternoon delivered to your house. That isn't really how it is in medicine. And I think psychologically, a lot of patients place that expectation on medicine to have an answer quickly and correctly immediately. And that's just not realistic if you're really doing good clinical
And how has
medicine.
that changed over the years? I mean, has it, because you said it's the Amazon effect. Is this something, and you've been practicing for decades now, is this something that you've seen in the last 10 years, 15 years? Or, I mean, just how have things
I would
changed?
say, yeah, that's really interesting. Also, I think it has to do with generational.
Mm,
If you have a baby boomer, they expect you to wait a little bit to get an answer. But if it's someone younger, in their, let's say, 20s or 30s, let's say, where they've grown up in an environment, they expect to have answers quickly, mouse click away, shall we say. If you don't get
mhm,
back to them in a certain period of time, then they're complaining to like online reviews about you, which isn't necessarily fair to the physician or the providers, because we're all doing our best to get through the work and to get answers to patients. We know it's how important it is to get data back to the patient and to talk to them about the results of a test, let's say, for example.
mm. So how would this have looked? I think this is so interesting that there's even the expectations can depend on the generation of the patient, and then the fact that technology now has made it so easy. Uh, so has that now, as we're everyone's getting old, has that just increased then this expectation, and that's part of the challenge?
Yes, and then also there's now you can message your doctor through my chart, let's say,
Mhm.
is one product out there. And so a patient may message their doctor 3 or 4 times a day, and that's a bit of an extreme.
Mm,
But a doctor, as you can imagine, has a lot to get through in clinic and also more urgent matters. And so sometimes the patient will make it upset that the message was not replied to. And so again, setting those expectations can be challenging.
mhm.
Again, people expect to get a response immediately, which is pretty much in our society for most things. But in healthcare, it does take time.
Mm. So even just so much of this is around managing expectations.
Yes.
And so this communication, and so even so what I'm hearing is that with medical practitioners, it can be exhausting, which is like, here's this expectation that I'm going to reply immediate when I'm actually with other patients too. And they don't get, and there's not like extra compensation for this extra back and forth as well, right?
That's true. There are some healthcare systems around the country that are charging people, and I think that that's to be determined whether that will be the norm going forward. As physicians, at least for myself, my goal is to communicate to get to the patient's needs and meet their expectations. The challenge, of course, is that there's only so many hours in a day, and if there's something emergent, I may take away from my ability to get through those messages in a timely manner. So most places say give the doctor 48 to 72 hours to respond through a messaging portal,
Mhm.
but sometimes that is lost in translation for certain patients.
Mm, mm. So there is the messaging, there's also these writing the online reviews.
Yeah.
It's so and so that can, I can imagine that can be hard for the medical practitioners to the physicians to get all of that. Is it, what's the upside? Is it, oh, now we have this documented that I did say this? Like, has it made it more clear because it's written now too? In terms of that accountability, I did tell you to do this. So, does it decrease litigation threat?
Yes. I think, it's interesting. Back in medical school, part of what's drilled into us is if you don't document, it never happened. So therefore, I think all physicians are taught very early on in our medical career that documenting the interaction with the patient is very critical, both for your own recollection in the future, but as you're alluding to validate that that discussion did occur. So I think documentation has always been there. It's just now the amount of documentation that's required is a lot more. And I would say personally, some of it is not necessary for good patient care. Some of it has to do with billing to get paid for the work. So more documentation is needed in certain situations for the insurance to justify paying for the service, but has nothing to do with the care of the patient per se. And that has been, I think we've seen more of that as the electronic medical records have been rolled out across the country.
So what I'm hearing for how communication has changed between the doctors and the patients, there's more opportunity for this written text message for what about, and then is there less time too with physicians now? I mean, does that mean, oh, well, we have this, so you don't have to have as much in-person connection? Yes,
I think
how's that
the
changed?
interpersonal, the interpersonal relationship is paramount to everything, I think. I'm sure all of us have typed a message on email and gotten a response and may have taken it a certain way, but in reality, it wasn't meant to be taken that way. But because you're typing it out, you don't get the intonation in the voice or the facial expression as it's being expressed. And I think that's really important, that when you interact, just like as we're talking right now, I can see your facial expressions, how you're reacting to what I'm saying, and vice versa. That's priceless. You don't get that in text or in an email. So a lot of times, if the message from a patient is extremely long, most doctors will say to their staff, let's go ahead and bring this patient in and let's have a face-to-face meeting to discuss all the questions that need to be answered. Because a lot of that can be done verbally and in person, which is going to be much more effective than trying to answer it in an email.
And I know that you worked all throughout the pandemic and did a lot of telemedicine. How did that change your interactions? Did it impact it or not?
Interestingly, I was more animated during the video visits. I had more facial expression. I was smiling a lot more because I could see myself in the video, probably more so than I would in clinic. And so I thought the interactions were quite effective and actually more engaging, actually. Just because I had this mirror to look at my facial expression. And I think I definitely was smiling a lot more. Because there is that barrier with the video, I made sure that I was exaggerating sometimes to my interactions with the patient to let them know I was listening to them, that I was acknowledging their concerns. And it's hard to do when you're not in person. So I actually adapted my own behavior during those video visits to make sure that interaction was not lost because of the video system.
That's so fascinating. And so how did that change your relationship, influence your relationship with your patients? Because I know that you have ongoing relationships with your patients, the ones who you saw before the pandemic, and then as you were serving remotely.
Yeah. It's interesting. There was a bunch of new patients that I saw first time on the video, and then finally we met in person in the clinic after the pandemic, improved. And I thought the interaction was actually more robust, having met them on the video first, just because I made that extra effort to connect with them. That when I actually met them in person, it just felt like we've been together this whole time in the office. But really, a lot of the initial visits were on video. So for me personally, it did not adversely affect my relationship with my patients. And if anything, it actually enhanced it because I was very aware of how I was coming across to the patient in the video platform. And that's why I like the feature of being able to see myself, because it allows me to adapt to how I'm coming across maybe to the patient.
That's so fascinating because I actually typically don't like to see myself. It's always a little, and yet it can have that. I hadn't thought about how it can help us understand how the patient, the other person, is interpreting us too.
Yes, I'm with you. Initially, I felt very awkward to see myself, but I kind of got over that when I realized how effective it was for me to see myself as I interacted with these
So
patients.
there are the times where it's the expectations around technology can lead to just some exhaustion, and yet at the same time, this technology, it's not that that's a blanket statement for all technology, because actually with the video chatting, it actually helped improve relationships. So what about with your coworkers?
Yes.
I mean, so we talked about a lot about the relationships and communication between physician and patients. What about within the team culture with other medical practitioners and with admin staff?
Yeah, so I'm just going to speak about being in clinic as a sleep doctor, realizing that my experience is not going to be the same as it would be in the emergency room setting or in the operating room type of setting. So I definitely interact with my staff with consideration and respect, acknowledging the hard work that they're doing, especially if they got off the phone with a very difficult patient. I can hear it outside of my office, and I tend to go and acknowledge the hard work they did to try to help that patient. Many times, the patient may not be the kindest to the staff, but are
Oh,
perfect with
wow.
me,
That
and
hierarchy.
so yeah, so I tend to put my ear out to make sure that I acknowledge the staff's efforts, because they don't get the respect necessarily that the doctor or the provider may get. Definitely pay attention to both the staff's needs as well as the patient's needs. Just because we're a team, I can't do everything. And if it wasn't for my staff, I wouldn't be able to do what I do. And ever since I was started in medicine, I always acknowledge those in the trenches, shall we say, helping patients. No, even though they're not clinical, but they're very integral to the well-being of the practice and making the practice flow. So I definitely work very hard with my staff, the administrative staff, to respect them and to acknowledge all the work that they're doing.
So, Dr. Chang, thank you for just kind of describing the hierarchy too, because there are all these. We always talk about how respect is dynamic, and it's dynamic because there's their power dynamics too. There's just the patient with the doctor versus the patient with the admin, and then within the staff. So when you were, is this something that that you were taught? As in school, do they, hey, there's going to be all of these dynamics in the workplace, or is this something that you kind of intuited and just learn from watching other doctors?
Yeah, that's a good question. I think I'm blessed. I think it came intuitively to me. I've definitely seen colleagues who struggled working with staff, who just, they're always in misalignment with their staff, and therefore their practice is not as efficient. I'm not sure if they really teach us this in medical school. I can't recall a class in how do you treat your staff appropriately. But I think along the way, because we work with so many different types of doctors in so many different types of settings, we tend to, I think, at least for me, absorb what works and what doesn't work. And so I think there's definitely a learning curve that some people pick up and some people don't. It's just one of those things where I think it's trial by fire for a lot of doctors as they go along in their career, to realize that it is a team effort. No matter, even if you're a solo practice, you definitely need staff to help support you to do that.
So we at CuriosityBase, we find so often that uh, there's no code, there's no guide for how to interact in the workplace, and so there are people who can pick it up like you did, and then there are those who are just flailing and they don't understand why the team is not functioning as well. And so much of that has to do with communication, and so much of that has to do with relationship building, and yet those are kind of unspoken.
Yes.
Yeah.
As a sleep doctor, we have night technicians. So I don't interact with half of my staff throughout my career as a sleep doctor. But I made a point to go visit them at night when they were coming on shift early on in my practice, to build that connection, to show respect, that I acknowledge that the work that they're doing, how important it is, and that they're delivering a lot of information to the patients, because they're with the patients for 12 hours. Yet for me, I'm with them for maybe half an hour to 45 minutes on any given visit. So I made sure that even this nighttime staff was connected with me, with them, but it had to be on my end to meet with them, to reach out to them, to get to know them as people, and for them to get to know me. Because sometimes if there's an emergency at night, they have to call the doctor on call. Well, I want them to feel very comfortable to reach out to me, because that could mean the benefit of a patient getting care or not getting care. And so that's, again, one of the ways in terms of showing respect is reaching out. Even though I didn't have to go in at night to visit with them, I made it a point to do so. And I think for them, they told me they were quite surprised when I first showed up, because they go, we've worked with other sleep doctors who never showed up. We didn't even know what they look like or who they look like. And I say, well, that's not really right, because you're part of my team. I'm part of you, right? And so that allowed us to form a very solid foundation early on, where there was trust built between both myself and the sleep technicians.
Dr. Chang, you're giving me I'm seeing how you were able to build this practice that then got all of these awards, because you're actually working with the night technicians and with the admin staff as a team and together to be able to serve your patients. And I think it's really interesting what you said about you knew you had to initiate that relationship building, and that you need to do that so that they could feel comfortable with you, because that power dynamic could be, well, I don't want to bother the doctor. So you knew you needed to do that. And so I'm just thinking how this applies to just leadership in general, just how often, hey, we can't just wait for other people to reach out to us, especially we have to consider our own positional power too. And so maybe we actually need to be the ones who are going to make that effort, and the positive ripple effects that does have. So with this series is called Respect in Practice, because I have this book called 7 Forms of Respect. And the idea is that respect is dynamic, it's subjective, it's relative, and it's contradictory. And that we can prioritize respect differently depending on the situation. And so you've talked a little bit about this just now, where how you interact and what you want to prioritize when you're with your admin staff and with the night technicians. What about with your peers, with other fellow physicians, and what about with with your patients?
I think with patients, at least in the clinic setting, punctuality is really important. A lot of the patients are coming in their lunchtime, or they took a half day off. They have other duties or responsibilities outside of the visit with me. So I make it a point to be punctual. Now, as a sleep doctor, it's a lot easier because there tends not to be emergencies. But if you're a pediatrician or internal medicine doctor, and someone comes in, let's say, with chest pain as an internal, that 15 or 20-minute visit is not going to be a 15 or 20-minute visit. Now you have to drop everything and assess how severe this chest pain is for this patient. So I think for me as a sleep doctor, I have the benefit of being punctual, and I put that as a high priority, as a respect of showing respect to my patients. I also, alluding to the fact that most patients come visit with me, let's say with snoring or sleep apnea, that they, again, are unaware of why they're there. Usually it's a partner or a doctor prompting them to come visit with me. And they're usually a little bit more skeptical. So I tend to acknowledge that they don't really want to be there with me. And then we kind of go from there. And usually I can see closed body posture when I come in, or a certain look on their face, knowing that they really don't want to be there. And so I really like to acknowledge that, because that allows me to say, I know why you don't want to be here, especially if they have sleep apnea, they don't want to go on a CPAP machine, which has no sex appeal, of course. And so from my perspective, I really want to acknowledge and to work with them. And I think, finally, just being considerate, consider anticipating what they may want from the visit, and also acknowledge and just identifying what their goals are is really important, because they may have a different agenda than what I think is, and that would not be helpful for them to be visiting with me. So I try to have some consideration for why they're there, and then go from there as well.
I appreciated how you shared that you get to prioritize punctuality because of your particular specialty of medicine, and yet for other specialties it's different. And we often think about that as what's the nature of the work, because the nature of the work will actually influence what are the forms of respect that you get to prioritize. All of them are important. We just can't prioritize all 7 at the same time. Now, I know you and I have talked about how actually a lot of doctors feel that they are not respected by their patients. Can you talk a bit about that? What does that look like?
Yeah, I think it's a very complex, that's a really good question, but it's quite complex, as you can imagine. I think just referencing the pandemic, we all know Anthony Fauci. And interestingly, as all physicians, we knew Dr. Fauci way before he became popular in the culture, in part because he wrote one of the sentinel textbooks in medicine as medical students. Funny thing, I never knew what he looked like until the pandemic came around, but I knew his name for sure. And I think in medicine, we tend to go with what we know based on research. And unfortunately, with the pandemic, I think there was a lot of other individuals giving information that may not have been completely true, clouding the picture for those who don't necessarily know medicine. And I think that put some patients skeptical of the medical profession, shall we say, in general. And then, as I alluded to earlier on in our conversation, medicine takes time. Good medicine takes time. And people are very impatient with information these days. And I think what ends up happening, if you're delaying information back to the patient by what the patient feels is the appropriate time, they get upset. Which is, I'm not sure if that will change in our society because of how quick information is being delivered these days. But again, also managing the expectation of the patient by the physician in terms of what an appropriate timeline may look like. So I think the onus is also on the physician to set the expectation with the patient, that based on my particular field of medicine, this is the timeline. My brother-in-law just had heart surgery up in Canada, and fortunately went very well. And he's ready to get back to work, and he had major heart surgery. And I'm telling him it's going to take about 6 months to a year to feel better. He's ready to get back to his work. And I'm like, no, it's going to take time. But it's also managing expectation and allowing him to say, okay, it's just going to take time, which I think in our society is something we don't value, that time is important to keep in mind as we want to heal. Yeah.
That's making me think about how doctors can communicate this, and it's up to the patients to also hear it and accept it, right? Because it could be, no, I'm going to be different. I'm going to be the exception. I will heal faster. And then there can be this, well, why am I not healing faster? And then where do we direct our what, anger, upset, disappointment, whatever that is that we're feeling?
And also, I think there's so much information on the internet these days, so you can find something that's going to validate your point of view, whether it's real or not. So like you're just alluding to, I should be healing quicker. And you'll look up something that says, yes, you should be healing quicker. Your doctor isn't managing you correctly, let's say, because you're not healing quicker. But is that person delivering that information a medical professional? Who knows, right? And so I think that's the problem, is that there's so much information out there, but many of it may not be validated by the medical profession, which clouds the picture on the part of the patient, because they're getting all this information that some of it may be valid, but others may not be.
So it's again, the availability of information can then change those expectations about and that then affects the communication, how we interpret the communication, and the relationship between the patient and the doctor as well.
Yeah, if the patient needs an hour of the doctor's time, but the doctor has only allotted 15 minutes because of all the things we talked about earlier imposed upon the doctor's time, the patient may not feel complete after that
Mm.
visit, right? And so even the doctor tried to fit in as much information in that 15-minute time slot, which is very good information. The patient doesn't feel that they were heard, let's say, or acknowledged in terms of their feelings. And so that's also a balancing act, is trying to find meeting the patient at where they need, at what juncture in their care. And that may affect the doctor's schedule for the rest of the day, and that's okay. But then the patient in the afternoon may get quite upset that the doctor was running late by an hour, but the doctor spent that extra hour with that patient in the morning because the patient needed it. And so all doctors face that challenge on any given day, or healthcare providers in general, because we try to be there with the patient, but sometimes that affects the schedule significantly, where patients later in the day may not necessarily acknowledge or care about.
And that's making me think about how sometimes we have to prioritize attention. In this case, it's just like listening, giving that attention that's needed. And then what we can't prioritize is honoring the time constraints, the punctuality, and even though you really want to, that's something you really care about. And yet sometimes there's going to be a conflict and we have to make a decision. And that gets at, it's not about always doing this form of respect. It's actually having to figure out what are we going to prioritize considering the situation. So audience, please do, if you have questions for Dr. Chang, please put them into the chat. We have talked about patient. I see here. Though I'm not a physician, I do a lot of work remotely. So I really appreciate Dr. Chang's insights interacting with clients remotely. What if any were any downsides for you with video interactions? Thank you, Daphne.
Yeah, great question. Clearly, when you're not in the room with the patient or with the client, you lose a lot. Like even right now, Julie and I are talking. I only see Julie's head. And so therefore, I don't know what her hands are doing, what her body language is. And same with me. You can just see my upper torso. I'm not using my hands as much, though. Even normally when I'm interacting with patient, I'll use a lot of hand gestures. That's just the way I am. So I think there is some thing through the video. Interestingly, when I worked with patients in their apartment or their home, I was able to see their living environment. So as a physician, it actually was quite helpful to get a sense of their life. You don't get that in the office at all. And during the pandemic, I was able to identify certain things and just bring it up as a conversation piece with a patient to get to know them better, or to even help them improve their sleep. I had a patient who was in a dark environment, she had blackout blinds, and it was like in the middle of the day. And I go, why is it so dark in your place? And she just said that's how she lives. And I said, well, maybe that's why you're having a sleep problem. And so that was quite helpful. I think something else that was lost during the video was not interacting with my staff as readily, because I was working from home. And so I think there was some things lost in translation, talking with my staff and communicating with them. I think that face-to-face is so important, at least for me personally, with my staff and other associates.
So interesting. It's so true that you get to see all the background and like all these insights that you wouldn't have otherwise. I have one last question for you. And this is, we've talked about your relationships with your patients, with the admin staff. And I want to know, what about with your peers, with other medical practitioners? And I want to explain a bit of what I'm interested in here. So I know doctors are in a role where they have to be very external facing, right? And it's almost like the patient is my customer. They will review me. And so in a way, the best of us can be we save the best parts of ourselves for our customers. And I know that you did make that concerted effort to be with your, to respect with your admin staff and your night technicians. What about with your peers? Because sometimes they can get the leftovers, because it's like, well, look, I've only got so much energy. How do you, and is that okay? Because then you're just like, look, we are all busy with our patients, and we understand that if we're a bit short with each other, that's okay. Or how do you communicate with your peers and build relationships with your peers?
Yeah, that's a really good question. I think as a physician in medical school, you're kind of at the bottom of the pecking order. And as a resident, you are as well. And then as you go through your career, you kind of work your way up to the top of the pecking order, um, so to speak. And I think for me, interacting with my colleagues has been one of the highlights of my career, in part because we get it. We've been through the process. We've been sleep deprived. We've been thrown into situations where we didn't really know what we were doing, but we knew enough to make the right decisions. And I think medicine and becoming a physician is such a unique process in all among all professions, because people's lives are at stake, right? And so if you're learning, you don't want to make a mistake. And I think that fear is something that most people don't necessarily go through as they're going through their career. And so as we interact with among colleagues, at least for me, it's been a pleasure. So I tend to give my best self to my colleagues, even though
Mm.
I'm exhausted, just because it's a show of respect that they know what I know, even though I'm in the field of medicine. I mean, sleep, but they may be in a different field. We have a very similar background. Now, I can't say that's the case for all of my colleagues,
Mm.
right? And so I think respect is really important because we all rely upon each other in so many ways, both outside of work and also when you're on call as a backup. Um, all of that, we rely on each other to do the work that we're doing. And also, we call it the practice of medicine.
Mm.
I'm not the expert of medicine, it's a
Mm.
practice of medicine. So many times there's things that you may not know or you need clarity on, that you may run by one of your colleagues in terms of just understanding more and understanding something that you may have missed, or running by a case scenario. And so in that respect, it's really collaborative, in my opinion, in terms of working with my colleagues.
Oh, so what you're describing is actually much more collaborative than what I imagined. I kind of imagined each physician with their own clinic and kind of just working in their own teams, and it sounds like there's actually quite a bit of dialogue and exchange and sharing of knowledge with each other.
Oh yeah, for sure. A lot of times we call it a curbside, where you may call up a colleague after hours and just say, "Hey, let me just run this case by you." And usually there's a good resolution in terms of the next steps for that patient. Again, I think most physicians are in the business of helping people. And so we try to make that our paramount goal on any given day, to work however we need to help the patient get the care that they need, despite the challenges that we're facing in healthcare these days.
Mhm. Thank you so much, Dr. Chang. Now we are winding down on our time, and I know that right now you are not actively practicing because you've got some exciting projects in the work, including, I'm just going to say it, a book. I'm going to say it. So could you just tell the audience what you are working on and where people can reach you and find out more about your work? Because I know how absolutely passionate you are about sharing your expertise.
Yeah, I think, thank you, Julie, for that. I think the biggest challenge for me as a sleep doctor is managing sleep apnea with the CPAP machine. Most people do not want to go be hooked up to a machine. And so my book is going to focus on traumas that people may have experienced in their lives that makes the CPAP usage very off-putting, or even scary. And in my experience in these last few years practicing, I've made a lot of headway with patients who had high resistance to going on a CPAP machine. And it's just been a joy seeing people assimilate to a therapy that they were so resistant to, and to empower them as patients to feel like they have control over the treatment, which is really a wonderful feeling if you're empowered versus disempowered. And I think a lot of patients who come visit with me when I was practicing were felt disempowered, that they were stuck. And I want to be able to help empower those patients feel that they're in control of the therapy going forward.
Mm. Well, I'm super excited for when your book does come out because I think it's going to help so many more people who aren't able to see you, who aren't able to visit you in the clinic. This is going to help you. Would you say 40 million people that are?
Yes, a lot of people.
Well, with that, thank you so much, Dr. Chang, for being with us today in our very first Respect and Practice Decoding Job Culture. Thank you, Curiosity Based audience, and have a good Friday.
Thank you, Dr. Pham, for having me. It's been a pleasure.